Hello and welcome to the channel. You know, childbirth is a beautiful and powerful journey, but sometimes it is needed to make a small cut during normal delivery. Small cut, where it is made in the perineum area. Perineum means it is the area in between vagina and the anus. So in that area, a small cut is needed. Sometimes not for all the women. Depending on the situation, this may be chosen by the doctors, depending on the situation. So, and medically, means in medical sciences, this cut is known as episiotomy. Episiotomy. That means a small cut is made in the perineum area. Perineum area is known. Perineum area is defined as the area between the vagina and the anus. Anyway, so I was talking about what is the requirement of taking such a decision to make a small cut. But just keep in your mind that this cut is not required for all the women. It depends on the situation. And we are talking about right now only normal delivery. Okay, this is not a cesarean delivery. This is normal delivery. So what happens actually, say for example, the baby's head is large. That means a large area is required to come out the baby. For coming out the baby, large area is required since the head of the baby is large. So in such case, a cut may be required. Okay. Or the baby's head is large and it is coming out, it is trying to come out quickly. In that case, a small cut is required. If you do not make a small cut, then there may be a chance, means there is a chance of unpredictable tearing of the perineum area. Unpredictable, and in that case, stitching and healing both become very critical. Stitching as well as healing, because if tearing occurs, so healing is required, and before healing, stitching is also required. So those things become very difficult. So in the cases where, so all these things are decided by doctors. Okay, if the baby's head is large and it is trying to come out quickly, because that means that doctors are not getting sufficient time to manage the situation properly without making any cut. So this is one case. Next case is if the baby is in distress. So if the baby is in distress, doctors are noticing that the baby is in distress. That means what is the requirement? A requirement to take the baby out from the mother's womb quickly, fast. Okay. That means the baby needs to be come out fast. If the baby is in distress, in that situation, doctors choose the option to make a small cut. That means they choose episiotomy in that case. But don't worry, episiotomy is done with a proper care and also anesthesia is used. Okay. Again, for few women, the perineum area becomes too tight. Means for their cases, perineum area, if it is flexible, then there is no problem at all. But if it is too tight, if the perineum area is too tight, in that case there may be a requirement of making a small cut. Okay, during the normal delivery process. During the normal delivery process. And one more thing, so after the child's delivery, stitching is done and therefore healing occurs. Normally healing takes a few weeks. Okay, a few weeks is required. This time is required for the healing process, and normally during healing process, medications, means especially pain relief, are prescribed by doctors, and you can take, you should take those pain reliefs only if these are needed. If it is needed, then in that case you should take pain relief. And normally doctors recommend to undergo pelvic floor exercises, but later on, not immediately after the delivery. Okay, later on, pelvic floor exercises. So these are the reasons why doctors choose episiotomy or why they choose to cut a small part of that area just to enlarge the opening of the vaginal area. That is the main purpose. Purpose is what? Purpose is just making the vaginal area wide, so that without any problem the baby comes out. So this is safer, this is safe for the mother as well as the baby, for both. Okay. So anyway, so this was all about today's topic. The topic was so small, so short actually, and there is no problem at all with this technique, so you don't worry if this is done. And I think doctors never ask the patient whether they will go for this process or not. Everything is decided on the spot during the time of delivery. Noticing the situation with their own eyes, immediately they take the decision. There is no time actually to ask the patient or the patient party whether they will make a small cut or not. During this is the part of normal delivery process. That means the utmost care should be taken. So if you are attempting for childbirth at your home, then that is too risky. Because the local people, means the people who are not actually doctors, they can't do this thing. They can't decide what to do depending on the situation. So childbirth at your home, in many cases this thing happens, so that is too risky. That is too risky for the mother as well as the baby. Okay, but in hospitals or nursing homes, these are experienced doctors are there. They decide according to the requirement. According to the requirement. This is not done for all the women. Okay. This is not done for all the women. Just keep in your mind, just to widen that vaginal area, this cut is made. That is the main requirement. Either the size of the baby is much, or that area, the vaginal area is too tight. It is not widening easily according to the requirement. Okay. Anyway, so this was all about today's topic. And anyway, so if you found this video helpful, so in that case, please like, share and subscribe to our channel. See you in the next video. This is the end. So thank you for watching this video.